Well, good afternoon on this hot summer day in August 2024. Today I'm going to tell you about when you're a cardiac patient, it's very important that everything is working properly with your digestive system, especially when you have stomach problems and all that kind of stuff, and especially when you just come out of heart surgery. It's very important that you keep your plumbing working. All your organs inside, they all react together like a machine. So if you stop going to the bathroom, you become constipated, it's important that you eat the right foods. A lot of vegetables, fruits, food you're supposed to be eating on a cardiac diet. And if you don't eat too much meat, and if you do eat too much meat, it can cause constipation if you're not gradually eating vegetables. A little meat like chicken's the best thing to eat in the cardiac diet. Chicken, vegetables, some broccoli. You're not becoming constipated because you're eating too much other stuff. And it can be a problem. And it could affect your heart. Everything stops up. Toxins tend to go into your bloodstream if you can't go to the bathroom. And it causes problems. It can cause you to get rashes, get sick, cause you a lot of things. And a lot of other problems, chest pains, and everything backs up on you. So, best thing to do is see a doctor, which I've been doing, my cardiologist. I recommend you stay on a low sodium diet, low sugar, eat a lot of vegetables, a lot of fruit, limit activity when you come out of surgery. Even if you're not a cardiac patient, you can have a heart problem if you don't eat right. Because you get constipated and you can't move everything out, nothing's moving, your plumbing reacts. But when it stops up, if you're not going to the bathroom for a few days, then it can be serious. Then you need to get checked. And then if you gotta, what I do, I take the Miralax, which is recommended by my doctor. It's backwards because it's called Miralax. That's the bottle it comes in. And anyway, that works. Doesn't make you go to the bathroom too much. It works in a few days if you're that bad constipated. It might take 1 to 3 or even 5 days. But it says you're not supposed to take it no more than 5 days unless prescribed or directed by the doctor. But what happens is your body stops up. You get bloated. And you eat, and it's still backing up. And the toxins are going into your bloodstream. And it's got to release itself somewhere. So it's either gonna either get you sick, could cause rashes, and all kinds of type of things, bacterial infections on your skin, and other type of rashes, and sores, anything on your body. It make you sick too, with fevers and stuff like that if you don't take care of it properly. And so when you take that kind of stuff, if it's really bad and the Miralax don't work, you can always take the Senecot or Senna, basically the same kind of stuff. That'll get you cleaned out in one day. The Miralax works in a few days, so you don't have to run to the bathroom back and forth. It makes everything move smoothly out of your digestive system. And it gets everything out. And you gotta worry nothing like that. So that's one thing. With the cardiac patients, you gotta make sure keep your diet properly, limited with the food you're eating. Not eating too much, not eating too less. Make sure you stay hydrated, drinking a lot of water, a lot of fluids. Make sure you're taking the foods in that's giving you vitamins that your heart needs and your body needs to help your heart pumping right. And that's how it works. And limit your exercises. It's not too much exercise, especially in this hot weather. It's 90 degrees out. Best thing to do is stay indoors. Limit activity. Get rest. And that's about it. Because most people just don't understand that some people get constipated. Oh, it's not a big deal. Big deal. A couple of days you go to the bathroom, it's the problem, But it is a big deal if you're a cardiac patient. because then you can cause probably chest pains and wind up in the hospital. It cause high blood pressure, all kinds of little things that becomes a big thing for cardiac patients. So that's how that is. So you gotta stay on a cardiac diet. Like I eat some fish. Like best if there was any cardiac diet is salmon. The salmon is a good diet. That's kind of fish because it's freshwater fish, no salt. And you're not supposed to have hamburgers, but once in a while you can have a hamburger. It's beef. Part of the cardiac diet is also hard-boiled eggs, like 1 or 2 eggs in the morning, some whole wheat toast or whole wheat bread, oatmeal, and not too much milk if you have lactose intolerance because of the gas. So that you take low-fat milk or almond and breeze milk. That would be my choice anyway. Other people have other choices. And chicken, steamed white rice, or whole grain rice, and nothing fried. Also, baked chicken in the oven. If you're gonna fry anything, you gotta fry it with. I use a little water, very little butter, so it's not too oily and greasy. So it's not gonna be causing problems with your stomach and cause any problems in your blood vessels. And that's really good thing to do, and your day will be going fine, and you start feeling better. You have good days, and sometimes you might have bad days, because sometimes the problem with the digestive system, it can always keep coming back with the problems because of the food you eat. So as long as you stay on a good diet, you shouldn't have any problems with that. And that's really it. And just wanted to say that out, give that a little shout out about that, because most people don't understand and think, well, big deal, constipation's not the big deal, it's not, not a big deal, it's a big problem, They think it's nothing, when it is something when you're a cardiac patient. It can also become a problem even if you're not a cardiac patient, because it can cause a problem with your heart. Because it makes your heart straining if you're trying to go to the bathroom a lot, and your blood vessels are being pushed and expanded, and your blood pressure gets high when you're in there trying to go to the bathroom. So anyway, just want to stress that out, so people that need to know this, they can know how to take care of it. Well, you all have a nice day. Hope this little information helped out a little bit for those who don't know. Those who do know, that's good. You have a good day.